So it's my greatest pleasure to invite Sara Sabukray to the stage. She's the founder of Comfy Dental Studio in Beverly Hills. A leader in cosmetic dentistry, Dr. Sabukray is renowned for her expertise in preventative and integrative care. She's passionate about offering holistic and personalized treatments, ensuring her patients receive the highest level of comfort and care. With her innovative approach and cutting-edge practice, Dr. Sabukray is redefining dental care and setting a new standard in patient wellness. Please join me one more time in welcoming the inspiring Dr. Sara Sabukray.
Hello again. So thank you for the introduction. Yes, so my name is Sara Sabukray. I am a dentist. And I am the founder of Comfy Dental Studio. I'm going to tell you a little bit about my story and how I got to where I am. I started out, first of all, any immigrants? A lot of immigrants, yes. So we're a land of immigrants. I'm an immigrant. I immigrated probably 4 times in my life, a lot of back and forths. But that has taught me a lot of lessons that I have been able to carry out through my journey. I first immigrated to the U.S. and then moved back to Iran. I'm from Iran, and I moved back to Iran, and I was working as an engineer. I went to school to be an engineer. I worked with my dad. We built a lot of hospitals. We were very successful, and when we decided that we wanted to move outside of the U.S. or back to the U.S., there were a lot of issues. I don't know if anybody's familiar with what's going on in Iran. It's a huge turmoil. I was arrested for going to a party, and it was actually a wedding and dancing, and I was whipped. So at that point, my dad decided that enough is enough. We're not going to stay here. We're going to move. So moved again. I moved to Canada. But before I did that, and I was an engineer and I was working, I loved design. My mom's a designer. My mom's an artist. And I was designing my own clothes. So I had my own fashion label, and I loved it. I would sell out. I was designing outerwear, and people loved it. Anyways, I sold out. I moved to Canada. And in Canada, I had a year gap. I didn't know what to do. I went back to school. I wanted to do fashion design and merchandising, so I studied it a little bit, and then it was time to now move to the States, back to the States again. I came on a work visa to work for a company that had gone out of business. And I decided, okay, now I'm going to go back to fashion design. So I went back to fashion school, got a call from the lawyer. What are you doing? I said, oh, I'm doing this. And she's like, well, you can't because there's no grace period. You should be working on a work visa. You can't go to school. I'm like, oh. So within a week, I had to find a job as an engineer, and I did. I found a job as an engineer, went back to work, worked as an engineer, project manager, worked my way up, was commuting about 4 hours a day. It was very depressing. We built we did the renovation of the Dodger Stadium. We built a lot of projects in Playa Vista. So it was a very hands-on, very masculine environment, and also the drive was not fun. Anyway, I ended up wanting to change, and like I said, we had a family meeting, and we sat down, and everybody's like, so are you happy? Are you happy? I was like, no, I'm not happy. I want to change. My brother was an engineer, went into medicine. He became a doctor. He was telling me you should go back to school. And I said, I don't know. I don't like chemistry. And he said, well, it's different here. It's going to be very different. So I took some courses. I fell in love with biology and chemistry. So I just started the path. I took some prerequisites. I started shadowing another dentist who was an engineer before. And I started doing research, and I fell in love with everything dental, so I applied to dental schools. Now you think, okay, now she's going to go to dental school, but no, that didn't happen. I met my husband, and we had to move because he had to go to residency somewhere else. So I got into dental school, I gave it up, we went somewhere else. And then I applied again, and then I got into dental school, and then we had to move again, so I gave it up again. And then for the third time, when I applied to UCLA, I got in, and then they told me, they said, so why should we accept you? Because who knows that you're going to come here? You gave it up twice already. I said, no, trust me, if I don't go to dental school, I'm going to go back to being an engineer. I don't care. I can't do this anymore. So I got in. I became a dentist. So, and then when I got in, what I failed to tell you is that I had a 10-month-old when I started dental school. So that was the other tough part of my journey. My support system, I just talked about it. My parents moved from OC, they had moved to OC, and then they moved from Orange County to LA to just come and help me raise my child. So they did that. I was a student, my husband was a resident, we had no money to get a babysitter. So they raised my child until I went to dental school, I graduated. I'm like, yes, I graduated, now I can start making money and I can go do this and that, and then COVID hit. I was like, are you kidding me? And then, so COVID hit, I'm like, okay, this is not gonna stop me. I'm not stopping here. I decided that I was gonna work. So I worked through COVID. Since the beginning of COVID, I saw 30 patients a day because I had no time. I was a late bloomer. I had to fast track everything, right? So I had to see enough patients to be able to be successful in what I wanted to do. And so I saw 30 patients. I went to Orange County. They rolled out the vaccines there first. So I went there and I lied about where I lived. I said, I still live in Orange County. I need the vaccines. And the guy figured it out. And he's like, I get it. What you want it. It's okay. Come on, I'll give it to you. So I got the vaccine so that I could work. Everybody would be getting sick and I was still working. So fast forward 4 years. I worked really hard. I worked at different offices. I did a lot of soul searching again. And I figured the way that everybody's doing dentistry is not the way that I want to do it. And I want to do it differently. And what's different about me is that when I'm sitting there with a patient, I really want to do what's best for them. And I want to know where they're coming from. I want to know how I can help them get to what their goal is, not what my goal is. I don't want everybody in the room to have veneers. If they want it, great, I'll give it to them. I love cosmetic dentistry. But if that's not your goal, that's not what we're going to have a conversation about, right? So I started getting the loans, doing everything, looking for a location. I found everything. And it was an evolution of how I wanted to set up my practice. And I started taking nutrition courses at Harvard Medical School online. And they introduced us to the concept of lifestyle medicine, exactly what we were talking about right now. And it evolves around exercise, sleep, meditation, which is stress management. Social connectedness, events are huge, avoidance of risky substances, and sleep. So those are the big things that everybody focuses on. And I said, okay, so if that's what gets people to health, that's how I'm going to do it, because your mouth is not separate from your body. So that's how I set up my practice, and one of the things that sets me apart in my field is the way I set up my practice is my patients do not feel like they're at the dental office, they feel like it's a spa. Besides that, when they come in, I give them robes and slippers, I pamper them, and then I let them meditate. So how do they meditate? I put them on a vibroacoustic bed that I researched and I purchased and I brought in. So it's induced meditation. Even if you can't meditate, even if you think it's not for you, which my husband thought, at the last 2 minutes you just let go and you feel like you're flying. So the experience has been when we do this and we bring patients in, they have less fear of the dentist, they're more compliant, they get to get healthier, their mind is more calm. And I can go on and on about how that affects your whole body and your mouth and all of that. But that's how we created a practice. And so I wanted to talk about, I've been asked to talk about the how that's related in a healthcare setting. But I don't know if anybody in healthcare here. Okay, so we have a few. So whoever's in healthcare, we know that we get really stressed out, but this can apply really to any kind of business, because we have patient care, everybody else has customer service, right? Well, we also do customer service, that's kind of what we do. But it's every entrepreneur's hours are long, right? We all have the administrative burden, as God knows we all do. The people that are helping you, the people that don't comply, the people that do comply, the trainings and all of that. So it's all a lot of burden, and we talked a lot about the work-life balance challenges, right? So it's not just the emotional stress, it's also the money. So when you are stressed out in any kind of work setting, the burnout, the decreased job satisfaction, the reduced quality of patient care, customer service, you get a lot of turnovers. Your staff wants to quit, they want to leave, they're not happy, they're burnt out. A lot of errors, it lowers your productivity, your bottom line, basically everything goes down the drain. You get a lot of sick days, yeah. So everybody talked about meditation. I love how everything's changing and the whole narrative's changing. Everybody is talking about wellness. Everybody's talking about meditation. This tells you that this is a movement, and this tells you how important it is. So someone once told me that when the AIDS or the HIV epidemic hit, everybody was trying to find the cure, right? Everybody was trying to find a cure, but then they decided, no, we should start doing prevention, right? So now is a great time for mental health, because we've had so many mental health crises. People have realized now we have to focus on the preventative side, right? So hence the meditation ideas. We all know it helps your focus. You're present in the moment, you're mindful breathing, you have to be non-judgmental. I think we talked about all of these. I was practicing this, and my daughter was like, that's what I always tell you. So they even teach this in schools now, how to meditate, how to be non-judgmental, how to do breath work and all of that. So there's scientific evidence, obviously, behind it. It lowers your blood pressure. I think we had that in one of the presentations. Like I said, it's so widespread now that in every kind of industry, everybody understands it. So lower blood pressure, lower cortisol levels, improved immune function, so you don't get sick as fast. Better sleep quality, great part of how it's related to lifestyle medicine. And then so you feel better, your emotions are regulated, you're more balanced, you're more resilient. When you fall, you get to get up again. And you make better decisions. So this is my vibroacoustic bed. This is how I implemented meditation in my practice, but there are other ways to do it. So practical approaches, we talked about the 5-minute, we talked about a lot of breath exercises. So the 5-minute breathing breaks, they're practical ways of doing it. We have a dedicated meditation room. Anybody can have it. It could be a little closet. It could be a little, I don't know, it could be your bathroom. So guided lunch sessions. So if you can have, I don't do that, honestly. I stagger my lunches with my staff because we're new practice. We want someone on the phone. So if you can have a lunch together, that way you can practice together. You can have community, all of those things can, and then mobile app subscriptions, those are great. Everybody talked about it. We have that, you had that whole presentation about the Calm and other subscriptions. So how do we integrate it practically? So when we come in morning huddles, we talk about it. We put it as part of our schedule. So this is not just for our patients, basically. That's what I'm trying to say. It's for our practitioners, it's for our staff, it's to have a better environment at work. So you're happy, your staff's happy, it radiates to your patients. They'll see it, they'll feel it, or your customers. We do it between patient appointments. I had my office manager at some point, I remember she was really stressed out. She's like, I'm gonna be on the bed. And we went and found her. She has her eye mask on, she has her headphones on, and she's meditating. I'm like, okay, great. So sometimes we do the end of the day wind down too. So we sit down, we reflect, and we talk, and we just leave it there and go, right? So there have been a lot of these things implemented already in a lot of healthcare settings. Mayo Clinic has a meditation program. Cleveland Clinic has a wellness program. Kaiser Permanente has a mindfulness training program. And it has shown, not surprisingly, that 37% reduction in stress levels, decrease in burnout, 28% improved in patient satisfaction. So they do a lot of surveys to find those out. So the way you can implement it in your business setting is that you can, like I said, simple techniques, the box breathing. You talked about the 4-4-6. We do 4-4-4-4-4 anyway. So you breathe in 4 seconds, hold, breathe out 4 seconds, hold 4 seconds. And then you do the body scan meditation. I think anybody who's done a yoga setup knows that you release every muscle in your body as you scan it. Mindful walking, that's the easiest one we do. So we try to walk to go grab our food and come back, and we try to make it mindful. Loving kindness practices, that's huge. So if you can just be kind to one another and make it part of your meditation, that's going to be huge for relaxation. Even if you want to yell at your staff, just breathe in and let out the kindness. So, like I said, online courses, meditation apps, local instructors. I'm a huge collaborator. So what I do in my practice is that if that's something I can't do and it's not my expertise, I bring in other people that can and will do it. So in my practice, part of my social connectedness practice is that I have monthly events. And when I hold my events, I reach out to different practitioners who want to come and help out, and they actually come. I've had breath work done before. I've had sound baths. We've had a stretch session, a static stretch session with a sound bath, and I do charity events as well. So that also makes you feel really good. So if you can do charity events, it's great for business, and it's great for giving back to the community. It makes everybody happy. It's that win-win-win. So those are the other things that I do. Anyway, so implementation timeline, if you've never done it before and you want to bring this into your practice, into your business, even if you're at home doing it, I think the 6-month program works really well. So you first kind of educate and introduce. It's great with any kind of implementation, obviously. So you first introduce and educate, and then you do the month second, you just do the basic training. Everybody learns about all these things, and then you go through the program assessment. So you have to kind of get a feedback, right? You have to understand what's working, what's not working. And then you implement some advanced techniques, and then you build your community again. So how do you measure your success? Staff surveys, you ask around, you say, how are you feeling? Again, check-ins are great. Stress level assessment, that's more subjective, but patient feedback is huge. Getting those reviews, getting people to kind of even give you a verbal of how they feel, how this made them feel. Every time I have someone go on that bed and come out, I'm like, so how was it? So I haven't had anybody say they didn't want it or they didn't like it. Everybody loved it. Everybody loves to relax, right? So it's huge if you can implement it for your staff or yourself. And then, again, check-ins, progress reviews, team feedback sessions, all of those things, I feel like those are repetitive. And then creating a culture of wellness. like I said, it's a great movement. Everybody's doing this now. I'm happy to be part of that and kind of being in there. I don't think everybody's done it the way I'm doing it in a dental setting, so I'm really proud of myself for that, honestly. So you have to lead by example. You have to do it yourself. If you're creating a brand, you have to be your brand. You have to practice it. I can't just preach. I have to do, right? So just as if you were doing it with your kids, you have to do it with your staff, with your patients, with your clients, with your customers, right? And then you celebrate your progress. As if you feel like you've done something right, like I did just right now, is that I feel like I've done this right. I'm happy, I'm proud of myself. Just do that, because that gives you motivation to do the next one, right? To go to the next level. And it's continuous, and share your success stories. Share it. It brings more improvement to your practice and to what you're doing. You're just going to get better and better and better at it, right? It has to be, that's why we do the check-ins. Whatever you implement in your business, it has to be sustainable, right? It has to be something that we can do. It can't be too big of a reach. And then it has to make everybody happier. It has to improve your patient care. So those are the little checklists you go by to see if you've been successful or not. And yeah, that's basically all I have for you. So if you have any questions, let me know.
Thank you so much. Thank you. What a beautiful and wonderful, incredible presentation. Any questions? Questions, additions, insights?
Oh, I have an offer. If anybody ever wants to come in, anybody in here, you have to tell me you're from this event. If you want to come and try this vibroacoustic therapy, you will be my guest. Come on in and try it out.
It's a very generous offer. Thank you.
We're right in Beverly Hills, so we're not too far away.
Thank you, thank you, thank you. It was so wonderful to have you here with us.
Of course.
Presents, flowers. Sara